Namaskar, good morning, and welcome to Apollo 24/7's Health Hour. Health Hour, as you all know, is a show where we bring you experts from Apollo hospitals to the live show where you can ask all your questions and queries in the YouTube chat. You must be watching us on the social media platforms of Apollo 24/7, like Facebook or Instagram as well. But if you want to ask a question that you want an answer from our expert, please do type your question on YouTube chat only, from where I shall present the question before our expert. And also on the show, we have a health quiz coming up towards the end where I ask you three questions and three people can win prizes from Apollo 24/7. That also you need to participate only on YouTube. And also, I'm going to give away gift vouchers, discount vouchers. You can use them wherever you're watching the show from. You can use them on Apollo 24/7 and get benefits as well. So stay tuned. Now we are going to invite our guest. Today we're going to talk about how to keep your kidneys healthy, and we have one of the best expert of the country, Dr. Ravi Vemagiri Andrews, senior consultant nephrologist from Apollo Hospitals, Jubilee Hills, Hyderabad. So he has more than 22 years of experience, and he specializes in the treatment of kidney stones, kidney failure, acute and chronic kidney diseases. He has published many papers and he has many medals, and he is a professional member of Indian Society of Nephrology, and the records that and achievements that he has on his name are: he's the first nephrologist to perform swap kidney transplant in AP, and one of the three nephrologists in India to perform a third kidney transplant in the same patient. So here we present you Dr. Ravi Vemagiri Andrews. Good morning, Dr. Garu. Welcome to the show.
Good morning, Jhansi. Thank you so much for the nice introduction. Namaste to everybody, and welcome to all the viewers on Apollo 247. Let's have a wonderful interactive discussion, and I hope we all set this new year off on the right foot.
Absolutely. The moment you are here, you bring so much of positivity, so much of energy. As usual, as every time I say, you are the star of the show. You are the star who leads us into good health. So thank you so much.
Not at all.
Can I one question? You always say that kidneys are very, very important. We know that these are the organs that filter, detoxify us, a lot of things. So पानी के साथ इनका नाता है. There's a lot of connection between the intake of water and kidney health. So you keep saying that water is not too much of water is not too good. But is that a myth or is that a fact?
Yes, I think the fact is too much of anything is not good. So definitely too much of water is not good. Too much of being bad is not good. Too much of being too good is not good. So let's focus on water and the kidney. Definitely, the kidney filters a lot of fluid, and it needs enough fluid to filter properly, and enough fluid to enter the kidney so that it's humming and buzzing. The fluid requirement for any normal person, if you ask me, would be about 2 to 3 liters of liquids per day. It doesn't necessarily have to be water. So it could be tea, coffee, milk, water, soup, other beverages. No alcohol, of course. We don't count that as liquid. I wouldn't want to count it as liquid. So 2 to 3 liters of liquid per day. That's for a normal person with normal activity. Suppose you're the kind of person who is sweating a lot, who goes out in the sun a lot, who does a lot of physical activity, does a lot of gymming, a lot of running, a marathoner. These group of patients would probably require 500 to 1 liter more. So about 3 to 4 liters for them. Otherwise, this myth of I'm drinking 7 liters of water per day, 8, 10, definitely not good, because one, it overloads the kidney, because whatever you drink, the kidney has to work overtime to get rid of it. Two, it can dilute all the chemicals in your body, specifically sodium. So high fluid intake can cause your sodium levels to drop, and drop in sodium levels can be extremely dangerous. You can have fits, you can be confused, you can go into coma. People have also died because of low sodium levels. And I would just like to share the story of Bruce Lee, the famous Kung Fu artist. So apparently, research has now shown after he died, there was a lot of conspiracy theories about how he died and all that. He was poisoned, he was this, he was that. But a few nephrologists went back in time and got some details, and they found that Bruce Lee used to advocate drinking lots and lots and lots of fluids. And apparently his sodium levels dropped, and that's one of the reasons why he had swelling in the brain and died. This is just a little bit of trivia for you viewers.
Oh,
Yes, so too much fluid intake, not good. Too less also not good. Ideally, 2 to 3 liters per day.
wonderful. So I wanted to start off with that note, and I know that you are the star. You know, now my audience know why I call Dr. Ravi Andrews the star. With all this trivia, he makes it so interesting. Ravi Garu, as you were saying that these are the filter, right? And we are blessed with two kidneys. There must be a balance in the body, but then there is also this that you can live with one kidney. This is also the beauty of the body, and there comes the
True.
beauty of the joy of regenerating life into somebody else. So being a transplant surgeon, how do you look at
Yes.
the one kidney and the failing kidneys and giving back life to somebody, infusing life to somebody?
Definitely, there is a fear that if you have only one kidney, your lifespan is going to be reduced, or you're going to get some kind of other complications. What we need to put into perspective is there are some people who are born with just one kidney. I mean, one kidney just doesn't generate. So they're born with one kidney. They live through their whole life with one kidney without any problems. And many a time, this is just incidentally detected that they have this one kidney. They have some scan at some point in time for some other problem, and then they find that they've got just a single kidney. And what happens if you're born with one kidney or you have one kidney removed for whatever reason? The other kidney starts increasing in size and compensating for the lack of its partner. So, research has shown that if you remove one kidney, so say you have two kidneys, you remove one, that means you have 50% of kidney function left at that point in time. That remaining kidney will develop and can take over up to 80% of the function of its function, so that you're almost at 100%. So you can live at completely normal life. And I would like to take the example of Anju Bobby George. We've all heard of Anju Bobby George, the famous athlete who won the bronze medal in the World Athletic Champions. I'm not talking about the Indian Championships or Asian or whatever, the World Athletic Championships, one of the top level athletic championships of all time. And she won a bronze medal, and she's got only one kidney. She was born with one kidney. So,
Okay.
as far as organ donation is concerned, before we, as transplant physicians or surgeons, before we decide to take a kidney from a particular donor, the donor is evaluated from head to toe, and we ensure that the donor has got no medical problem before we progress and we proceed to remove that kidney. And again, research has shown that those who donate kidneys live longer than those who do not donate kidneys. Now, this could be sound like a shocker to people, but I'm not trying to recommend that we should all donate kidneys that we can live longer. But the reason why this is a skewed perspective, the reason why donors live longer than non-donor is because donors are established, proven, healthy individuals. Before donation, they're checked
Right.
from head to toe, and they made sure that they are absolutely bona fide healthy individuals. Whereas those who do not donate, they don't have these health checkups, and they might have some little grumbling problem somewhere along the way, which can reduce their lifespan. So the recommendation here is one: don't hesitate to donate the kidney if you are otherwise fit and healthy, for your loved one. I mean, you don't have to donate to anybody, just for your loved one if they really require it. And two, we can use this as an opportunity to have a complete body checkup and ensure that you're a normal, healthy individual.
Wonderful, wonderful. Of course, there are stringent rules and regulations when it comes to organ donation, and I think Jivandan is a great scheme, and we have what do you call streamlined quite a bit of organ donation, and I think now we have reached an era where there's enough awareness of organ donation. Much to be done. There's so much more to be done. So with that, I see a lot of people who are joining us and putting in questions. Sabina, No Name, Harish Ramachandran, Kapil Rawat, David. I'm going to ask your questions very shortly. Keep your questions coming in.
Yes.
Before I move on to the audience, Doctor, Ravi Garu, there's one thing that we all think that kidney is a filter, but then it is not just an independent organ. It is also a part of other network. So what are the other organs which might cause a problem to kidney, and what are these problems that we can expect?
Jhansi, the technical term that you're looking for is organ crosstalk. This is the medical term that we use. where different organs they communicate with each other. This is called crosstalk, and they help each other or impede each other depending on what that particular organ situation is. Now, the one thing we
Yes.
need to remember that our body is one. It's a single body. These all organs are there. We try to separate them and say liver, kidney, heart, brain, but actually it's all just one body. And there is interconnection and communication between each organ. And definitely, if there is a problem in one organ, be it the kidney, the liver, the brain, the gut, whatever, there will always be an impact on another organ. But
Yes.
apart from that, the organs which commonly impact on the kidney are the liver and the lung and the gut, if you call the gut as an
Hmm.
organ, because I think that's what we should. So the kidney
Yes.
is definitely impacted almost directly. So there are a lot of diseases which involve the kidney and the lung simultaneously, the kidney and the liver simultaneously. So these three organs are very close to each other. And of course, the heart, because the heart is what pumps the blood to every organ. And if the heart is in trouble, then every other organ also starts giving trouble because they're deprived of blood supply. So this is what happens, this crosstalk between all organs, and it's important to look at the body as a whole. So instead of saying, how do you want to keep my kidneys healthy? I don't think that's the right question to ask. What we should ask is, how do I keep myself healthy? And you can keep yourself healthy by keeping all your organs healthy, including the kidney. And there is a very nice quote from a person called Jean Kerr. She was an American comedian. And she said, I am tired of all this talk about beauty being just skin deep. What do you want? You want a beautiful pancreas, is it? But I beg to disagree with her. Yes, I want beauty which is skin deep, but I want a beautiful pancreas, I want a beautiful kidney, I want a beautiful liver, I want a beautiful heart. And there is a way to getting to this. I think as this program evolves, we will discuss that.
Yes.
But the one
We.
solution to having a healthy body is exercise, lifestyle modification, and diet
Yes.
control and stress management. These things should be there in your life so that you can maintain a healthy body. Let's not just talk about a healthy kidney. And that keeps all
One.
your organs healthy and keeps you going.
Great. Thank you so much. So, lifestyle, stress, and other dietary conditions, we do come back there. But as we start, I want to take up Ajay, 52-year-old male. His question is, uh, please give me tips to prevent kidney stones. While we talk about kidney health, can you please broadly categorize what can be the kidney diseases? And we do hear about kidney stones quite a lot. So, what are these, and how do they form? And what are the other forms of kidney problems?
Yes. So there are many different ways of categorizing kidney disease, but the commonest way is to categorize it as an acute kidney disease versus a chronic kidney disease. That's the most common way of categorizing, and it's the best way of doing it. Now, basically, the difference between the two is not the severity or the intensity, it is the duration. So, if you have kidney disease which has been going on for 3 months or more, we call it chronic kidney disease. And if it is being going on for less than 3 months, it is acute kidney disease. How do we establish this? We can establish this by doing a simple test which can be done at any lab called a serum creatinine. If your serum creatinine 3 months ago, say in October or September, your creatinine was normal being 1.3 or below, and now it's become 3 or 4 or 5, then you have acute kidney disease. If you have a creatinine which is already, say, 2 in September or October, now it's become 3, then it's called a chronic kidney disease. The difference between the two is acute kidney disease can be, if it's identified, it can be treated and reversed, and you can get back to a normal kidney function. Whereas chronic kidney disease cannot be reversed and it will progress. The causes of acute kidney disease are infections, medications, drops in blood pressures, any blockages like stones or any prostate problems. These are the common causes of, or medications. These are the common causes of acute kidney disease. Whereas chronic kidney disease, the commonest causes, as somebody said, the first commonest cause is diabetes, the second commonest cause is diabetes, the third commonest cause is diabetes. But that's the commonest cause in our country as well as all over the world. But hypertension comes a close second, and plus all the other things like recurrent stone disease or inadequate or inappropriate use of painkillers or other over the counter medications, Ayurvedic medications. So, this is how we differentiate acute and chronic kidney disease. The main goal in a person who comes to a kidney specialist with kidney disease is to identify first whether this is acute or chronic. Because once we know that, then we know in which direction to go and what the outcome is going to be. Once we identify it's acute or chronic, then the management and the treatment will vary depending on the underlying cause. Now, the question
Right.
about stone disease, what commonly causes
Yes.
stones?
Ajay.
Yep.
Ajay
So
was
Ajay
asking.
has asked that question. It's like any other disease. Even stone disease is a combination of a genetic preponderance with an environmental trigger. So there is a genetic for most diseases. There is a genetic tendency, say diabetes, blood pressure, whatever. There is a genetic tendency, and with that tendency, if there is some environmental trigger, the disease will manifest. In stone disease specifically, the environmental triggers would be if you drink less water, or you get dehydrated for whatever reason, or you have high uric acid levels, you have high calcium levels. There's something called oxalate that can, if that is high, also you have a chance of getting stones. So basically, a genetic tendency with a trigger like drinking less water or taking too much meat in your diet, taking too much oxalate in your diet. Oxalate comes from spinach and tomatoes, basically. And if you take too much calcium. So there are basically four different kinds of stones which are commonly found. One are calcium stones, two are oxalate stones, three are uric acid stones, and four are infection stones. So the general methods to prevent any of these stones is to ensure that you drink at least 3 liters of fluid. I did recommend in the beginning that you should have 2 to 3 liters, but those with stone disease, it's very clear that they should have at least 3 liters of fluids per day. Plus, cut down on the non-veg. Cut if you're having stones, and cut down on the spinach and the tomatoes. And you can just go to Google and find out the things which have high uric acid, which have high oxalate levels, and which have high calcium levels, and try and avoid them.
Wonderful. तो कोई पूछ रहे थे, Mr. Manoj was asking, sir, whenever I eat chicken or protein food, there is some back pain on the next day. So is this related? And somebody else also was asking, excess protein. Harish, I think, was asking, does excess protein cause load on kidney?
Definitely, excess protein would cause a load on the kidney because ultimately the kidney has to process it and excrete it. But again, it depends on what do we mean by excess protein. I mean, what is the definition or benchmark for excess protein? What I would say is eating non-veg every day, large amounts, would be counted as excess protein, unless you're one of those avid gymmers who burns a lot of calories and wants to build up muscle. For those people, yes, you can have protein or non-vegetarian every day. Otherwise, for normal people who don't do too much exercise or more or less sedentary, not more than alternate days, so not more than 3 times a week of protein intake. Veg protein is easier and better to take because it's easier for the kidney to process it, but animal protein is difficult, so we need to be careful about the amount of protein that you take. As far as the first question about back pain coming on because of taking excessive chicken, I think it's just a coincidence because it's not like you take chicken and suddenly the kidney gets overloaded and you have back pain. All back pain is not necessarily related to the kidney. There are a lot of other reasons for the back pain. It could be the spine, it could be the muscles, it could be some other just a strain or whatever, not necessarily kidney pain. So I think that first question where it was, can excessive protein or chicken intake cause back pain? No, that's not the cause. You need to find another reason for your back pain, sir. But taking too much protein definitely overloads the kidney. So I would recommend for those who are not too much into physical activity, have veg protein, and there's no limit to the veg protein you can. So you can have paneer, you can have milk, you can have curd, you can have pulses. All these are sources of veg protein.
Wonderful. So while we're talking about understanding kidney health, you were talking about creatinine. Kapil Rawat is asking, is garlic beneficial to reduce creatinine production? In the same line, Dasari David is asking, how does urine protein and creatinine ratio indicate kidney condition? I know these are two different questions, but then creatinine annamata, that very word, that is an indicator or the gateway of your kidney health. So what are these ratios? Who has to keep a monitor on it? Why does one need to put stress on reducing creatinine so much?
Creatinine is an indicator for kidney function. This is the simplest and the most basic test we have to find out somebody's kidney function. There are other more advanced and established or better high-end investigations to exactly understand how the kidneys function and what their function is like. But creatinine is a simple baseline thing which we can do at the bedside. Even done at any lab, it can be done at bedside as well. So it is a surrogate marker for kidney function. So if the creatinine is little high, then you know that you have some kind of kidney problem. But there are certain kidney problems which start before the creatinine going up. And one of the
Mhm.
first indicators of a kidney problem without an elevated creatinine is a urine protein. So if you have protein in the urine, that is, and you might still have a normal creatinine, that is an indicator that you have some kind of impending kidney disease. And it's important to figure this out because if you can identify it early and treat it, you can reverse it. In fact, that's what we do in diabetic patients. In diabetic patients, if you can find early evidence of protein in the urine, there are specific medication that we can use, which can reverse the proteinuria, and we can protect the kidneys and prevent the rise in creatinine. About this ratio of the protein creatinine ratio, generally to find out the amount of protein you're losing in the urine, there's a cumbersome test called a 24-hour urine protein. So for that, you'll have to collect urine in a can over 24 hours. And frequently there are errors in this collection because you might sometimes end up collecting 36 hours because you might start collecting early morning, which is actually the urine which has been collected over the night. So there's a very specific method of collecting it. If you make errors, you're going to get a wrong report. So you might, and also collecting it every for 24 hours, putting urine in a can is not an easy thing to do. So it has been found that if you do a spot urine protein and a urine creatinine, and you take a ratio. So you put on the numerator, you put urine protein and put on the denominator urine creatinine, whatever ratio. Say you get a ratio of 2. That means you're losing 2 grams of protein in 24 hours. If you have a ratio of 3, it's 3 grams. So and we extrapolate that to the 24-hour urine protein. So this is an easy method to tell you whether you're losing protein in the urine or not. Now, the basic investigation that anybody needs to do for identifying a kidney problem is one, do a serum creatinine, two, do a complete urine examination to look for protein in the urine, three, check your blood pressure because many a time blood pressure is elevated in kidney disease. And I'm sure there's something I want to dwell on further on during this conversation. Once we get a question on blood pressure and the kidney, I'll discuss that as well. And
My
four,
next
an
question is
ultrasound
ready.
of the kidney. Four, ultrasound of the kidney. So these basic tests have to be done. When do we do it? Ideally, by the age of 30, everybody should have this done once. Because unfortunately, kidney disease is very silent. It's very dangerous. It's very slimy. It's very sly. You will not know that you have something till it's too late. And symptoms start after third or fourth stage. If you have 5 stages of kidney disease, after the third or fourth stage, the symptoms really start. By the time it's too late. So every person below 30 should have these four tests done. I know everybody has a blood sugar done, everybody has a CBP done, everybody has a blood pressure checking done by the age of 30. Sometime or the other it's done. But nobody really checks or makes an effort to check a creatinine, a urine, and an ultrasound. So by the age of 30, at least once, 30 to 40, at least once in 5 years, 40 to 50 years of age, once in 3 years, 50 to 60 years of age, once in 2 years, and over 60 every year. These four tests need to be done. I'll repeat: serum creatinine, complete urine examination, ultrasound, and blood pressure measuring. Now, this is for a standard normal person. If somebody already has a problem, say at the age of 30, you've got diabetes, then you need to do these tests more frequently. For diabetics, we need to do these tests at least once in 6 months. So,
Correct.
normal person, we can do it at more longer intervals. But somebody who's already got some other disease in some other organ as well, like we said, organ crosstalk, we should do it more frequently. I
Wonderful,
hope I've
doctor.
answered
So
all
what?
the questions.
Wonderful, wonderful. That's the reason why I say that once the moment you come, it's a bundle of information, encyclopedia sitting before us. So all these tests, I suppose, are very simple to take. You can just book them on Apollo
Yes.
24/7, my dear audience. Let me remind you, it's just a simple click and book your test. So next, as you said, I'm opening the Pandora's box of diabetes and hypertension together. So a lot of
Yes.
questions around BP. But first, let me start talking about two questions. Sabina Hamid ji पूछ रहे हैं, what are the special precautions that a diabetic and a hypertensive person should take to avoid kidney issues? That is one in general. Two, Kapil Rawat पूछते हैं, can 130 by 90 BP damage kidney over a long time, say in 10 years? And three, Anak Chaudhary says, sir, creatinine right now is 1.9, but BP is very high. My doctors advised me to take Telma 80 at the night and Silakar in 10 in the morning. Is that okay? So now we find that hypertension in a lot of questions. I see hypertension marked even as I scroll down. What is the relation between hypertension and kidney?
Before that, Jhansi, I missed out answering one question from the previous question was
Yes.
about garlic and kidney disease and blood pressure.
Yes.
Garlic garlic does not. I wish it was so simple. You make some change in your diet and everything gets corrected. No, but definitely diet plays a role in every disease, and including kidney disease, blood pressure, diabetes as well. It has a definite role to play. As far as garlic is concerned, garlic is proven to reduce blood pressure, and blood pressure is very closely related to the kidney. So indirectly, having garlic can definitely reduce your risk of worsening of kidney disease. It might get you a little less friends because of the smell of garlic, but otherwise, from a personal and medicinal perspective, definitely no harm in taking a little bit of garlic. Now, coming back to hypertension and kidney disease, um, it's a classic chicken and egg scenario. What came first? Did blood pressure come first or did kidney disease come first? And it's that question, like the chicken and egg scenario, has never been answered, because blood pressure can cause kidney disease can cause blood pressure, and they can both perpetuate or increase the intensity of each other. For example, if you have high blood pressure, your kidney disease can get worse, and as your kidney disease gets worse, your blood pressure gets worse. It becomes a vicious circle. Till maybe 10-15 years ago, the concept was blood pressure is related to the heart, but the concepts have changed now, and it's been scientifically proven and known that the kidney is the seat of blood pressure. The kidney is what causes the blood pressure. The heart is a victim of blood pressure, it's not the cause. So, if you have high blood pressure, it's more likely that you have got some kidney disease, which is why I was talking about those four things that you need to do to identify whether you got a kidney disease or not: blood pressure, CUE, creatinine, and ultrasounds. So, high blood pressure can probably is because of your kidney dysfunction or whatever, and it can finally lead to heart disease. So, it's very important, and blood pressure can cause organ damage anywhere. Because if blood pressure is high, pressure in all the organs will increase. So, your brain can start giving trouble, you can have strokes, your heart can give trouble, you will have heart attacks, your kidney will give trouble, you can have kidney failures. So, all these things are where blood pressure is a root of all evil. So, yes, blood pressure, kidney have a very close relationship, and it's important to control the blood pressure to, one, reduce your risk of kidney disease, and if you already have kidney disease, to reduce or slow down the risk of progression of kidney disease into something worse. Do you want me to talk about diabetes now itself, or for the next question?
Yes, doctor. Before that, before we get into diabetes, here's a should I continue taking my BP medications? Was one question. See, BP medications, and will that have increased medications? Will that have an effect on my kidney?
Definitely, if you want to look at it absolutely straightforward, if you don't take BP medicines and don't control your blood pressure, you will definitely worsen your kidney function.
So
But
it's
there are
not
certain
like
blood pressure.
BP medications will have a problem on kidney. It's not that. People, the question was intending कि अगर मैं ज़्यादा BP medication लेता हूँ तो क्या मेरे kidney health पे effect गिरेगा?
Yes. So I was just coming to that. So there are some blood pressure medicines which can injure the kidney, and that will be decided by either your nephrologist or your physician will decide which blood pressure medicines you can use at which point in time. There are probably 8 or 9 different categories of blood pressure medication. So we have a huge variety, a huge uh, group of medication that we can use for controlling the blood pressure. So based on individualization, so this is what we're talking about, individualizing a prescription. There's no common prescription for everybody. Depending on your kidney function and other parameters, the physician will decide which antihypertensive or which blood pressure medication that you can use. But definitely,
Right.
you should not stop blood pressure medications out of fear that it can cause kidney damage. It's worse to stop them and have high BP. That will definitely damage your kidneys. So let your
Right.
physician decide what medications you should take. Now, apart from the medications, there are nowadays there are a lot of other methods that are coming out to control blood pressures, especially in people. This is called refractory hypertension, where you cannot control blood pressure even if you're taking three different groups of drugs at maximal doses. So there are other methods. There are surgical methods which we can use to control the blood pressure, which can be done in a cath lab, where we remove the nerves of the kidney or through the cath lab procedure, and that could control your blood pressure very well. Sometimes there are blockages in the kidney vessels, and if that's relieved, the blood pressure can be controlled. So what we need to do as physicians is identify the person who has got uncontrolled blood pressure, try and find out the cause. Many a time the cause of this uncontrolled blood pressure, in spite of taking medications, is either dietary indiscretions, so they're taking a lot of salt, or the medications are being missed, or they're not being taken at the appropriate timings, or they're not being taken at the appropriate doses. So these things are something which the patient along with the doctor should cohese together and figure out and move forward.
Right. Now let's move forward to diabetes. Now, diabetes and hypertension were supposed to be hand in glove partners or together. For a very long time, we thought these two were the, one causes the other causes the, or increases the other. But now we have established, now that you have established that kidney also is the third partner in crime or the affected party of the crime. Let's talk about diabetes. While Sabina ji was already asked, ki, how do I manage my diabetes so that my kidneys are not affected? Her other question also here, where's your other question, Sabina ji? इसलिए मैं पूछती हूँ पूरे ऑडियंस से एक साथ पूरा टाइप कर दो so that I don't need to scroll down. Does high diabetes cause a rise in albumin in the urine?
I will be a little technical answering this question, but basically there are 5 stages of diabetic kidney disease, which has been established over the years, and it's irrespective of whether you're type 1 or type 2 diabetes. These 5 stages of kidney disease, diabetic kidney disease, have been studied in type 1 diabetics. But you can, by type 1 diabetics, I mean somebody who starts off with the requirement of insulin at a young age itself. Whereas type 2, initially they don't need insulin, they can manage with medicines. Then over a period of time, they require insulin. So this is the differentiation between type 1 and type 2. So diabetic kidney disease has been studied very carefully and very clearly in type 1 diabetics, and you can extrapolate these same findings into type 2 diabetics. So the first stage is what we call the stage of hyperfiltration, where a lot of blood flows to the kidneys and you have a lot of urine, which is typical what we see in diabetes. Initially, they're very thirsty, they're hungry, they pass a lot of urine. So that's the first stage. And in this stage, the blood pressure does not rise, and there is no protein in the urine, and the creatinine is normal. Again, going back to the basic tests for kidney disease: blood pressure, protein, and creatinine. And these three establish whether somebody has got diabetic kidney disease or not. So, first stage is more urine. Second stage, and that comes in the first two. We don't know when it comes because we have not identified it at that point in time. Then is the stage of clinical latency, where again you have no symptoms, no BP, no protein in the urine, no creatinine. The third stage is what we call the stage of microalbuminuria, and this is the crucial stage. If you can identify it at this stage, that means there is protein in the urine, and you find that out by doing something called a microalbumin test, which is done again simply, or a urine protein creatinine ratio. If this is positive, if you start treatment here, you can reverse it and you can avoid the risk of diabetic kidney disease. Stage 4 is when the proteinuria is a very high level, and there's nothing much you can do then to reverse it, but you can definitely limit the damage. And in the stage 3, you have protein in the urine, creatinine normal, BP is normal. Stage 4, you have a lot of protein, and the BP also starts to rise. And in stage 5 is what we call established diabetic kidney disease, where the creatinine starts to rise. So stage 3, you can reverse if you can identify it. Stage 4, you can limit the damage, but you cannot reverse. And stage 5, again, you can limit the damage, but you cannot reverse. How do you do all this? The treatment of diabetic kidney disease, one is tight control of blood sugar. So your HbA1c should be below 7%. Two, tight control of blood pressure. Your blood pressure should be below 130 by 80. Three, diet control. You have to make sure you don't take too much salt, too much sugar, no sugar at all, and avoid too much protein. Unless you're losing a lot of protein, then you need to replace it. But if you're not losing a lot of protein, then don't take too much protein and take switch to as close to a vegetarian diet as possible. That means maybe once a week or twice a week of non-veg, the rest of the time you eat veg. And finally, regular exercise. Now, this is something which I want to emphasize throughout this talk, because exercise is the game changer. We talk about work-life balance, but you need to add work-life balance is a straight line and it will never balance. It will always be tilting. So you need to add good health to that line, and you need to add exercise to that line. Exercise is non-negotiable. We all think, okay, if I have time, I will do it. If I have motivation, I will do it. But as one person once said, my day has only 22 hours, not 24 hours. 2 hours are for exercise. Exercise
And
is a
I
given.
definitely
Exercise
think
is
that
non-negotiable.
that person is you. The person who has said that must be you, because you take time for
Absolutely.
your health.
It is non-negotiable. It's like eating, drinking, sleeping. So you have to find time for it. So that's what will help you not only take care of your disease. When I'm talking about health, I'm not talking about general health. I'm talking about lifestyle diseases like diabetes, blood pressure, kidney disease, cancers, other obesity. All these things are strokes, heart disease. These are all lifestyle
Yeah.
diseases. And today we're talking about lifestyle diseases. That's the bigger killer nowadays. And we need to maintain those at a proper level by taking proper medications and top it off by exercise, which should be absolutely regular and daily. So all these things together, diet control, weight control, BP control, blood sugar control, specific medications for the protein, these will help you avoid or prevent diabetic kidney disease, hypertensive kidney disease, any disease. If you want to ask me, it's a blanket solution for everything.
Wonderful. You will not believe, my dear audience, because today Dr. Ravi Andrews was the guest on the show, I extended my exercise by 30 minutes. Sir, na बहुत अच्छा health सेहत का
If
exercise
I
के
can
साथ
convince
ख्याल
one
रखते हैं.
person, if I can convince one person about the importance, then my day is done.
Wonderful. So while we're talking about the gym and exercise, Shaina is asking, for a moderately active person, no gym, how much of protein is okay so as to not to harm the kidneys? That was one. And there's a person who's an avid, Mr. Subramanian, where's your question? I should have written it somewhere. He's an avid gymmer and has a problem, nephropathy unka ye hua hai. Now what's the protein intake के बारे में उनको क्या करना है? I did not find his name, but that's the, yes, I got it. Prakash Subramaniam. I've been diagnosed with IgA nephropathy and I also go to gym. I'm a bodybuilder. How many grams of protein can I eat in a day?
Yes. So we'll first answer the question on the moderate exerciser who wants to know how much protein they want to take. Now, like I said, if you don't have any kidney disease, and we can prove that by the simple 4 tests that I suggested, then you can have as much protein as you want. See, it's not easy or it's not possible to have too much protein. I mean, how much protein can you eat? How much meat? How much chicken can you eat? There is a limit to that. Your body will
Yeah.
not allow you, your stomach will not allow you to eat so much protein. So, eat what you want as much as you want. Make sure you don't eat the wrong things. By the wrong things, I'm talking about too much fat and oil, too much salt and sugar. These are the bigger dangers as compared to protein itself. It's what goes along with the protein, because along with the protein, you probably take a lot of salt, you might take a lot of sugar, you might take a lot of oil. These things are what you should watch out for, not the amount of protein that you're taking. So if you're doing moderate exercise, eat whatever you want, as much as you want, but within the limits of not too much salt and oil. And again, what do we mean by moderate exercise? Now, the WHO recommends that you do 150 minutes of exercise per week, at least. The operative word here is at least. You have to do at least. That does not mean you do 150 and say, I'm done. You have to do more. And the more you
Yes.
do, the better it is. The more you do, the more protein you can take, the less dietary restrictions happen. So
Correct.
don't go by this at least 150. Do more than that per week. And then
Yes.
you can eat
I've
whatever you
hacked
want.
it. I've hacked it by adding a small after meal walk, 10 minutes after every meal. I think that's how I've increased my exercise routine. That can help audience
Absolutely. You have to
know.
find your own way of motivating yourself, finding the time. All of us are the same 24 hours. We need to find
Correct.
time to do it. And that's it's not very difficult because people who are really busy can also do it. So this is for moderate activity and how much protein. So again, I would say why stick to moderate gymming? Do a little more, do a little extra,
Then
and then eat a little more if you want. As far as Prakash Subramaniam is concerned, his question about IgA nephropathy and how much protein to take. If you are a bodybuilder and you want to build up muscle mass, then yes, you will need to take more protein. But what you need to check on a regular basis is your urine protein and your blood pressure, because the key in IgA nephropathy is controlling the protein in the urine and controlling the blood pressure. And there are any number of medications which could help you do that. So I'm sure your nephrologist will definitely guide you as far as how to control your blood pressure and control the urine protein and the creatinine if it is elevated. My suggestion to you would be if you have IgA nephropathy, try and cut down on the protein a little bit. I'm not telling you to totally go onto a veg diet or a very low protein diet, but the recommendation would be 1 to 1.5 for a gymmer who wants to build up muscle, 1 to 1.5 gram per kg of protein per day. Otherwise, gymmers tend to take 2 to 3 grams of per kg of protein per day. You need to cut down on that. Make sure you drink enough water, but more importantly, control your salt intake. That would could be a game changer. So I think Prakash, you should continue gymming. Just make sure that you don't have by too much protein. I'm talking about chicken, one whole tandoori chicken, one whole chicken a day, or 3 4 egg whites a day. That's a little too much. And another point I want to stress here is the protein supplements which are being marketed left, right,
yeah,
and center. My
yeah.
strong recommendation to everybody, every viewer, is do not take protein supplements. Anything which is perishable is good. That which is not perishable is not good. That is the rule of thumb. Anything which is stored and can be kept is not good for you. Something which cannot be kept, which should be finished off there and then, is good for you. And all these formulas and these protein shakes and all these protein powders that are marketed have preservatives in them. And the biggest and the commonest preservative is salt. So if you taking too much salt, you already have a problem. And high protein intake along with the preservatives, definitely not for your good for your kidneys. If you have kidney disease, so 100% no protein supplements unless you're taking not natural protein. Even if you don't have
Okay.
kidney disease, the recommendation is not to take protein supplements. Just take natural protein. Unless you're into active bodybuilding, or bodybuilding is your profession, or it's just you're doing it to win any contests or something, then you can do go overboard, but then finally at the end of the day, at some point in time, you'll have to pay for it.
Wonderful. So, doctor, while I take next question, no name का question लेना है मुझे, उनका नाम नहीं है, but Savita Mukhi has pointed out, sir, मेरी birth से single kidney है, abnormal location, abnormal size also. I am 73 and leading a normal life. I thought we should appreciate
Fantastic.
her. Yeah.
Absolutely. It's great going, and so nice of you to share this on this platform. More than me saying all this and telling everybody that a single kidney is fine, the person who's actually been there, done that, living with a single kidney with abnormal position, abnormal shape, 73, fantastic. Hats off to you, ma'am. And thank you so much for joining us and giving us this comment, because I don't need to say anything anymore now. That's it. I've said it all as far as the kidney is concerned. Single kidney living well,
Right. I thought it
fantastic. Good
is.
for you, ma'am.
I found it really interesting that she could share that bit and motivate a lot
That's
of
the
people.
beauty of it. I mean, having it and going through it is one thing, but actually sharing it on a platform like this, where she can reach out to
Correct.
so many people, is wonderful. Thank you so much.
Yes. And now coming to no name, sir, I'm having PANCA positive. I'm not sure how to pronounce that. It goes and comes back. I have taken cyclophosphamide, rituximab, and steroids, myclophenolic acids, etc. But it comes positive even after 2 3 months. I'm still in medication. Any advice?
So I think it is APLS, right? APLAS, isn't that it? The syndrome?
PANCA.
Oh, ANCA.
PANCA positive.
Okay,
Ha.
that's ANCA. It's yeah, kind of vasculitis. Yes, unfortunately, vasculitis is something which cannot be cured, but it can definitely be controlled and suppressed. The way to suppress it is with what all medications you are taking, and There are two types of vasculitis: those which go into something called remission, where after the treatment they quieten down and they don't manifest again, and sometimes they can recur. They go into recurrence, where in between they'll keep rearing their head. So the only solution for recurrence of ANCA would be to continue to keep on giving medicines as the symptoms come back, and as the symptoms go down, reduce the dosage of medicines and keep them at the bare minimum. So I'm sorry, but there is no definitive solution for this. You just need to continue the medications. And anyway, there's so much research going on now on vasculitis. It's a very rare disease, so we didn't have enough armamentarium till now, but now as it's getting more common and more research is going on, I'm sure there will come a time where we can give you some medications which can put you into complete remission. But for right now, you will need to take these medicines on a regular basis, with of course adjusting the dose based on your clinical symptoms and your investigations.
Wonderful. So next question is Asif Malik. His child is suffering from moderate hydronephrosis in left kidney. Please advise fulgurated twice.
Yes. So, Asif, this is something which probably has come from birth, from childhood. Uh, the only treatment for this would be a surgical option, and fulguration has been done, but it has surgical options do have their limitations. If the kidney function is all right, that means hopefully the other kidney is functioning well, then we don't need to worry too much about this kidney giving us trouble. So you will definitely need to see a pediatric nephrologist and a surgeon as well together, and figure out which is the best way forward. If not fulguration, if there is there any other option of treatment. But definitely, I'm pretty sure the function is overall normal. I'm sure the other kidney is working well, for which you don't need to worry about too much. And if this kidney is giving trouble, the one which is being operated 2 or 3 times, if it gets infected or it starts bleeding, then you might have to get it surgically operated. But I think you need to follow the pediatric kidney specialist and the urologist to figure this out.
Yeah. So it's 11:47 already. I'll have just 8 to 10 minutes to conclude the session. So Anand, Prashant, and Raja, all these people are asking about cholesterol, triglycerides, and the connection between kidneys. So one quick observation there, doctor.
Yeah. So cholesterol and triglyceride get deposited in the blood vessels and they cause them to get narrowed, and these can reduce the blood supply to different organs. So it's as simple as that. So high cholesterol, high triglycerides can impair the blood supply to any organ, and kidney is a very vascular organ. It requires a lot of blood flow. In fact, the kidney demands more blood flow than any other organ in the body except for the brain. So if the blood supply to any organ is impaired, the organ will start giving trouble. The way to reduce your cholesterol and triglyceride is make sure you eat less oil in your diet, you exercise regularly, and if they're still high, there are a lot of medications that you can use to reduce the levels of cholesterol and triglyceride.
Yeah, yeah. So there are a lot of personal questions with a lot of creatinine levels and other questions. May I request all of you to kindly, we have left a link of Dr. Ravi Andrews on Apollo 24/7. He can be consulted, and I'm taking up larger questions which can impact many more people. So next question
It will
is,
be a pleasure to answer all the questions
yeah, yeah, yeah.
online. All it will be a pleasure. Yes.
Correct. And the next question is UTIs, recurring UTIs, and what do they talk about kidney health? And while we talk about UTIs, Ramji Sharma, does UTI infection have a bearing on the rise of one's creatinine levels?
So UTI is basically a urinary tract infection, and there are certain situations where it happens. Either the patient who is getting the UTI has got diabetes or some other condition where his immunity is less, he's unable to fight out the infection, or there's a problem in the urinary tract where the smooth flow of urine is impaired for whatever reason. So there's stasis of urine or stagnation, and that can get secondarily infected. And which are these things? It could be either stones, or it could be prostate problems, or it could be some narrowing in any of the urinary outflow tracts. uh, Medications which are not being given appropriately, wrong dosing, wrong medicines at the wrong time, can also cause urinary tract infections. So we first need to identify the cause of the urinary tract infection. Caused by, I'm talking about first identify the bacteria which is causing it, and also finding out why that particular bacteria is causing that urinary tract infection. So for that, we will have to do something called a routine urine, a urine culture, and an ultrasound to look at any blockages or anything. And recurrent urinary tract infections can cause the creatinine to go up, because the urinary tract also includes the kidney. So we're not just talking about the bladder and the urethra and the ureters. The kidneys are also part of the urinary tract, and if they get infected, then the kidney dysfunction can start and the creatinine can go up. So urinary tract infections should not be ignored, and it should be scientifically treated, in the sense that you need to find out which bacteria and give the appropriate antibiotic, and also make sure that you identify any other anatomical cause for it and treat that. To prevent urinary tract infections, you have to make sure you take plenty of liquids. You have to make sure that if you have any immunosuppressive condition like diabetes, you need to treat it and keep that under control. You need to exercise regularly. See, exercise is a one-stop solution for everything. You need to exercise regularly. You should not take unnecessary medication. If you take an antibiotic, you need to take it a proper course of at least 5 to 7 days. And I will talk a little bit about cranberry juice. Cranberry juice
Yes.
has been scientifically proven to reduce the incidence of urinary tract infection, especially something caused by a bacteria called E. coli. And E. coli causes 80% of urinary tract infection. So if you can drink 2 glasses of cranberry juice every day, provided you're not a diabetic, then you can reduce the risk of getting a urinary tract infection. But more simple than that, drink plenty of water, exercise regularly, keep your sugars under control, and cranberry juice
Yes.
as and when you think you can have it.
Yes. So Balaji's question, sir, my ultrasound KUB impression says bilateral raised renal cortical echoes. Please tell me what it does mean and how much should I worry?
Yeah. We all assume that an ultrasound or a CT or any of these imaging tests are the gold standard. But actually, they're not. What we're talking about is two-dimensional images in gray, black, or white. So they will only give you a guide. They will not tell you a definite cause or the problem or a solution either. So we need to take all these investigations with a pinch of salt. Actually, don't take it with a pinch of salt, not with a pinch of sugar either. Not no salt, no sugar, just with a sip of water. Probably take all these with a sip of water. So,
Yeah.
uh, renal parenchymal disease or echogenicity on the kidney is something which we see very often. It is just an observer dependent thing. So anybody, it depends on the person who's doing the scan. It depends on the quality of the machine which is doing the scan. It also depends on the habitus or the appearance of the person. For example, if you're very obese around the belly, at that time the ultrasound will not be giving you a proper idea, and every kidney will look like it's echogenic. Apart from what it looks like and the echogenicity, what is more important is, like I said, the size of the kidney, the urine routine test, and the creatinine. If these are all normal, then you don't need to worry about the echogenicity. It's just something like somebody is dark and somebody is fair. That's it. So unless it is very severe, for example, if they say grade 3 echogenicity with small kidneys, creatinine is elevated, then you need to worry about it. Otherwise, if it's just echogenicity on the ultrasound with a normal size, normal urine routine, normal creatinine, just forget about it. Just don't worry about it.
Wonderful.
Take it with a glass
So
of water, not with a pinch of salt.
yeah. So steroid usage के बारे में, Dinesh is youngest brother is 28-year-old, AKI, CKD, right kidney is shrunk, creatine level was 10 when he was hospitalized, now is at 4.3, omnacotil 7.5 per day. Advise if there is a need to increase steroids and food, etc. I think that's a detailed question, but
Yes,
somebody else was asking rheumatoid arthritis hai kisi ko and steroid usage hai, what kind of effect will the kidney have? So I thought steroid questions ek baar dal dete ho.
absolutely. Now, the first question about the creatinine being 10 and going to 4.3 and the steroids on is fine. We can only answer this question once we know what the underlying cause of the creatinine was, and I'm sure a biopsy or something would have been done. And already it was established that there was a small kidney on the right side, so there is already a chronic kidney disease with AKI. So they got it absolutely right, AKI on CKD. So creatine 4.3, I think, is acceptable compared to a creatine of 10. So definitely a significant reduction. It might not come to normal, but I think the omnacotil should continue. Now,
Okay.
talking of steroids, there is always a misconception among the general public or the non-medical public that steroids are the ones that you use to build up your muscle. Actually, there are two types of steroids. One are anabolic steroids, which people like Ben Johnson and all these athletes and all use to improve their performance. Those increase your muscle mass and they have a different set of side effects. And the others are something called corticosteroids, which we use as for medicinal purposes for people who have got some diseases. And omnacotil is a corticosteroid, and it's used for we use it post transplant, we use it for rheumatoid arthritis, we use it for vasculitis. There are a lot of other autoimmune diseases for SLE. So steroids definitely have a place in medicine. They are a double-edged sword, but they're very useful in certain life-threatening situations. And definitely for rheumatoid arthritis, if steroid is required, we should take it. Steroids don't have a direct implication. At least the corticosteroids don't have a direct effect on the kidney. Anabolic steroids do have direct effect on the kidney in the sense they can
So,
increase the blood pressure and cause hormonal disturbances and all that. Whereas corticosteroids are mainly non-renal side effects, like your bones can get weak, so you can correct that by taking calcium. You can get acne, so there's nothing much really you can do about that. You can get cataracts, you can get surgeries done for that. So your blood pressures can go up, so reduce your salt intake. Your weight can go up, reduce your dietary intake, do more exercise. It can increase your blood sugars, so keep your sugars under control by diet and reducing the sugar and taking medications. So these are all the side effects of corticosteroids. But I think if you don't look at the side effects and look at the effects and on that particular disease that you're using it for, I think that's what you should go by. And your doctor is the best person to judge because they will be monitoring all the side effect levels and making sure that you don't get into too much of those, but also the effect as well and seeing how well your underlying disease is responding to the steroid. So don't worry about taking corticosteroids. It can be life saving, and your doctor is the best person to judge and make sure that you're taking it at the appropriate dosing for the appropriate times. And for all the side effects, you have measures in place.
I wish I had one more hour with you to complete all my questions, but I have only 2 minutes to go. So, quick rapid fire
Uh,
yes no answers, please. Gurudeep says,
yes.
past history of proteinuria, itchy sensation, right flank area, all pathology, radiology say normal now. Any other diagnosis?
So we need to know how much proteinuria is there. I don't know if he's had a biopsy done, but sometimes proteinuria can be associated with itching. There are certain kidney diseases which have itching as well as proteinuria. So you need to see a nephrologist and do more detailed investigations.
Wonderful. So, yes or no rapid fire for you now. Sabina, me, does taking antacids in the long run damage kidney function?
Sorry,
Antacids in long run.
I'm sorry, I didn't get that. What? Come again? What in the long run?
Antacids. Antacid.
Antacids. No.
Okay. Happy, motivated employee. Okay. High uric acid. Okay. I think that should be it for today. And yes, swelling of the feet. Is all swelling of the feet or no swelling of the is related to kidney disease? And even if there is no swelling, can it be kidney disease?
There are 7 or 8 causes of swelling in the feet. We'll quickly go through them. One is thyroid problems, two is low hemoglobin, three is heart problem, four liver disease, five kidney disease, six drinking a lot of urine, seven some medications, eight if there are any blockages in your blood vessels like DVTs. So there are 7, 8 causes
Yeah.
of swelling. Kidney is one of them.
Okay, great. So, can green tea or morning black coffee can affect kidney in a good way?
No, not at all. Have your
Okay,
green tea, have your black coffee, have your brown tea, have whatever color tea you want. Just make sure you have enough fluids per day. Non-alcoholic.
Won- wonderful. So, with Purnima Dinesh's question, I would want to lead you to top tips. IgA nephropathy with diabetes or any other kidney complications. Can you please give us tips to manage with diet and exercise as well? So, top tips over to you.
Yeah. So the top tips would be control your blood pressure, control your diabetes if you have either of them. Make sure you drink enough fluids, appropriately 2 to 3 liters of fluids per day. Get a kidney evaluation at some point in time in your life, and based on your age group, decide which are the ones at how frequent intervals you need to get them done. So the basic tests need to be a blood pressure, urine evaluation, creatinine and an ultrasound of the kidneys. Make sure you exercise regularly, and that is the key. So the key to keeping your kidneys healthy are regular exercise, control of diet, control of blood pressure, control of blood sugar, avoid unnecessary medications, especially painkillers, antibiotics, and ayurvedic medications, and most importantly, don't get scared. Have a positive attitude, because even if you have a kidney disease, most of them can be taken care of. If you cannot at least reverse them, at least you can slow down the progression. And we have enough in our armamentarium in this age and this day, where we can take care of kidney disease to a large extent. And still, at the end of the day, if your kidney is completely going downhill and there's nothing more we can do, we have the options of dialysis, we have the options of transplant, which can make you into a normal person. And there have been even athletes who had kidney transplants and gone on to score goals in Euro Cup. There was a person who was a striker. He had a kidney transplant and he managed to score 4 goals. So be positive. Life is wonderful. Enjoy it. And I think that's more important than just focusing on your kidney. Think about your whole body as a whole and enjoy your life, and make sure you exercise regularly. Thank you very much.
Wonderful. As I always say, you are the star. You lead our health hour so very well. Positive information, bundle of energy you are. Thank you so much for being here with us today.
Thank you. My pleasure.
Thank you. So quickly, I know short past our time, but I'm taking forward with health quiz. 3 questions. Quickly answer kijiye on YouTube chat only. You have to type your answer, and winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/17. And if I take your name to be the winner, you have to write back to us at marketing@apollo247.com by Wednesday every week, with all your details like name, address, etc. And gift vouchers will be shared with you. आज के 3 questions आपके स्क्रीन पर हम डाल रहे हैं, and answer it only on YouTube chat. Fill in the blank. Humans can live normally with just blank kidney. How many? That is answer. Fill in the blank. O से शुरू होता है, E से end होता है. Question number 2. True or false? Kidneys remove waste and extra fluid from your body. Is that true or false? Kidneys remove waste and extra fluid from your body. True or false? Question number 3. Yes or no में answer कीजिए. In a single day, kidneys filter about 180 liters of blood. Is that true or false? Yes or no? In a single day, kidneys filter about 180 liters of blood. So go ahead, please give your answers in YouTube chat. And here are the health coupons that I want to share with you that you can use on Apollo 24/7. The first one being Ask Doc 150, ASKDOC 150. This is the code that you can use on Apollo 24/7 and get 150 rupees cash back when you consult top doctors direct from Apollo. And the next one that we give you is First 3, FIRST3. You get up to 25% off on online medicine orders when you buy it direct from Apollo 24/7. You get a 2-hour delivery as well. And this is valid on the first 3 orders of 1,000 rupees or above. The next one that we give away is for exclusively Health Hour viewers. Use the code HH247. Please use this code and get 199 rupees off on online consultation with Apollo doctors and 20% off on medicine orders when you use this on Apollo 24/7 app. And by the way, Apollo 24/7 app can be used on WhatsApp as well. So WhatsApp के लिए आप ये number save कीजिए 09355247247. To avail healthcare services, you can text or call on WhatsApp, and you're just a call away. Well, next week we are going to talk about an important subject. We're going to talk about cholesterol. Cholesterol कैसे कम करें? हिंदी में बात करेंगे हम. We are going to talk about cholesterol and the ways how you reduce it. 4th February, 11 a.m. We are going to get back to you. And time for our winners this week. Anu, Sunil Krishna and Buddhadev Bera. I repeat the names of our winners, which will be left in the chat box as well. You need to contact us at marketing@apollo247.com and give your contact details. Anu, Sunil Krishna, Buddhadev Bera. You are the winners for this week. Congratulations. And we shall see you next week. Thank you all joining and asking your questions. Keep your questions coming. Thank you. Namaskar.